I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and today we are talking about the U.S. Preventative Task Force recommendations for screening for breast cancer. This is the final statement that they released at the end of April last year, and they recommend that women get mammograms every other year, starting at age 40 through age 74. This is wrong for so many different reasons, and this is why. This was preventable. This patient learned about these guidelines and decided that she was going to skip her 2024 mammogram because she had gotten one in 2023. And then there was a few months delay into getting into her PCP to get the mammogram ordered because at that point she felt a lump. And by the time she finally had her mammogram at the end of the year in 2025, this is what it showed. She felt a lump under her nipple and she reassured herself that it was probably just a cyst, but she told her PCP about it so they could order a diagnostic mammogram instead of a screening one. And by that point, she had a large triple-negative breast cancer. She did end up needing chemo as well as immunotherapy, and luckily it shrank and she was able to have a mastectomy and get reconstruction with a plastic surgeon and then continue getting immunotherapy for the duration of a year. She had an excellent response, but if she had not had the delay in her mammogram, she probably wouldn't have needed a mastectomy because this might have been caught at a much smaller size. You can see that this area is a pretty significant chunk of her breast, and the only circumstance in which someone can still have a lumpectomy is whenever the whole ball shrinks concentrically down to a tiny little spot of cancer, and sometimes that happens, but sometimes it doesn't. I've also seen many patients who have developed cancers in their 80s and have a reasonable life expectancy. We can expect that they'll live until their 90s or even 100, and it grew to this size because someone told them they didn't need mammograms anymore. And had it been caught at an earlier size, they also could have gotten away with a lumpectomy and a far less invasive surgery. So please ignore the U.S. Preventative Task Force recommendations. Get a mammogram every single year, starting at the age of 40, unless you're high risk, in which case you might consider starting younger. And get a mammogram every year after the age of 74, as long as your PCP tells you that you don't have anything else like heart failure, lung failure, kidney failure that might mean that you have bigger things to focus on.